Hi, welcome to another CBT and me video. Today we're going to be talking about psychosis. I think there's a lot of myths about psychosis, and although it's quite a scary word, it's surprising how little the general public can know about it. So today is all about understanding psychosis, understanding what the symptoms are of it, why we get it, what causes it, um, understanding the sort of terms that you might hear in psychosis, and also hopefully making it a little bit less scary for people so that they do understand what's going on with maybe their loved one or themselves, because actually psychosis is quite common. So without further ado, let me get up my slideshow. Okay, so we're going to be looking today at what is psychosis and what is psychotic experiences. And just as a reminder, I'm Molly. I'm a qualified CBT therapist. You can access the videos that I make on my Facebook page, which is again CBT and Me Self Help. I am on Instagram now, CBT and Me, and I also have my YouTube site, which you can find me on. But before we get into things, it is important that I just talk you through where you get more help in the UK. So obviously this information I provide is quite generic. It's not aimed at anybody in particular. It's just information that's generally helpful for people to know. If you want specific advice, you can go to the NHS website. If you want personal advice, or if you feel you need support or your loved one needs support, I would recommend that you go to your GP, who can, give you specific advice and make any referrals that you may need. If you think that you are struggling with psychosis or your loved one is, you can also find your local mental health helpline. This is particularly helpful if maybe you can't get hold of your GP, or it's out of hours or on a bank holiday. You can go to this website here, and that will help you find your local mental health helpline, because each area in the UK will have their own helpline. If it is an emergency, though, and you can't keep yourself safe, or you're worried about somebody else's safety, then please do call 999, or you can go to A&E as well for a place of safety and for professional support. It is important, if you think yourself or a loved one has psychosis or is noticing some of these symptoms, getting help early can be really vital, because it can support a better recovery and better outcomes in the future, which we'll talk more about later on. But if you're sitting there watching this video thinking, do I need help? The answer is probably yes. It's always good to get help if you're thinking about it. It may not mean you have psychosis, but I find with most mental health problems, the sooner we seek help, the better, so we can also nip things in the bud earlier. So without further ado, then, let's talk a little bit about psychosis, because there's lots of myths. And one myth is that people with psychosis are dangerous. Now, yes, it is true that sometimes when people are very unwell, they can do things out of character. But statistics show that actually people who suffer mental health conditions are more likely to be a victim of crime than a perpetrator of crime. So that's a complete myth. You may have seen things on sort of films and social media about psychosis. You might hear talk about people being crazy. Things like The Shining portray sort of psychosis and schizophrenia in quite scary lights. And often what we see in the media isn't as true as we would think it is. Because obviously it's a film, it's for entertainment, it doesn't always portray the full truth. Another thing that I get asked a lot is psychosis where you have split personality? And no, it's not. And we'll go into more detail about what psychosis actually is. But no, psychosis and schizophrenia and related conditions are not split personality. So first of all, to let you know that psychosis is actually a lot more common than you might think. And actually, surveys have shown that around 1 in 10 people hear voices that other people don't hear. hearing voices is actually a very common experience. And let's face it, 1 in 10 people do not have a long-term psychotic illness. And actually, we've all probably had sort of some similarities with psychotic experiences. For example, have you ever been sort of walking down the street and you thought like someone called your name? Or have you ever sort of seen something at the corner of your eye, or seen a shadow that you thought was something else? Actually, we all have sort of what's called anomalous experiences, and they're more common than we think. Now, for psychosis, the lifetime risk of you getting psychosis is approximately 1%, and on average, there are 20 new cases per 100,000 in the population identified per year. The World Health Organization studied sort of the occurrence of new cases in 10 countries, and they put the rate of psychosis at around 1 in every 200 adults. So again, it's more common than you would think. Now, the risk for males developing psychosis, the risk increases around sort of 15 to 24-year-old males. And the risk of getting psychosis does become lower with the increase of age from sort of 24-year-olds onwards. The risk for females is slightly different. So your peak risk of getting psychosis is when you're around 25 to 34 years old. And then again, the risk of developing psychosis after that is lower as you progress. Again, this data is for sort of several different populations. But there is an additional risk period when you're around age 45 to 54 for both women and males. That can also be a period where people are more likely to have an episode of psychosis in their lifetime. Now, again, it's more common than we think. So if we think about famous people, you might have heard of Peter Green. He was the guitarist in Fleetwood Mac. And he talked quite publicly about his experiences having schizophrenia. We've also got John from the Red Hot Chili Peppers. He used to be the guitarist, and he sort of publicly told people about his experiences hearing voices. You've got Lionel Aldridge, who's a football player, and again, he had schizophrenia. Winston Churchill, who was the Prime Minister of Britain in the past, people might have heard of his sort of experiences with depression and what he called the black dog. But actually, it's been documented that he did hear voices, and these voices would command him where to sit, where not to sit, and sort of give him commands. Salvador Dali, who's quite a famous surrealism artist, he said that he downloaded information from another realm, which inspired him to do his artwork. And he also experienced hallucinations, which again was an inspiration for his art. Sigmund Freud, who's quite a common name in psychology, he's a psychoanalyst in the past. He reported hearing voices calling his name when he'd sort of be out and about. And we've got an actress called Zoe who says that she used to hear voices and sometimes still does, telling her, don't do this, don't do that, sort of commenting on things. And again, these are just a few cases, but actually it just goes to show that, people from all walks of life can have psychosis. Now, I'd like you to think about mental health being on a spectrum. Because actually we all have difficulties with our mental health. Now, think about this end of the spectrum being more sort of mild difficulties, maybe difficulties with stress, anxiety, low mood. And then we may have more severe difficulties and mental health disorders on this side. So if we think about depression as an example, I'm sure every human being has experienced some mild low mood, whether that's, some days where we're just really sad, really unmotivated, or just feeling quite flat and empty. If you think about sort of clinical depression being in the middle here, But again, we can have different levels of severity of depression, and some people can become severely depressed where maybe they're not doing much at all, they can't get out of bed, they're not washing and dressing, they're sort of neglecting themselves and really unmotivated. And it is common that people with that sort of severe range of mental health can get things like psychotic depression. So towards the sort of end of the spectrum, the more severe end, mental health can tip into psychosis. And again, I've seen many patients with sort of common anxiety conditions. For example, maybe they've always sort of been a worrier or someone who's anxious about their health or struggled with sort of generalized anxiety. And sometimes when mental health gets to more the severe ends and that people are really struggling, it can just tip into psychosis. So again, it is a common experience for lots of different diagnoses and problems. Now, just to mention, psychosis isn't actually a diagnosis in itself. So the word psychosis is used to refer to an experience, so a psychotic experience. Psychosis is actually a symptom. It's not a diagnosis in itself. Now, some doctors and psychiatrists may describe someone as having psychosis rather than giving them a specific diagnosis. This is often because, as well, though, it takes time to give people a full diagnosis, and sometimes we don't have enough information until we've sort of known that person for a long time and gathered a full picture. And some people actually prefer to just be sort of hearing the word psychosis rather than giving a formal diagnosis as well. Psychosis can appear in some mental health disorders. So, for example, like I said, severe episodes of depression can flip into psychotic depression. Psychosis can be a part of disorders such as schizophrenia, which is probably the disorder that lots of people think of when they hear the word psychosis. People who experience bipolar disorder, if they're having a manic episode, again, they might start to experience psychotic symptoms. As we talked about already, people with anxiety disorders, when it gets to a certain level of severity, it can just flip into psychosis. Schizoaffective disorder, again, can include psychotic experiences. And personality disorders, again, when people have high amounts of distress, it's not uncommon to have psychotic experiences within personality disorders. Postpartum psychosis, again, is where a mum might have had a baby recently, and again, they can have psychotic experiences after sort of having a baby and giving birth. Which is classed as a mental health emergency too. So, you know, please do keep an eye on new mothers who are struggling. Not everybody who has a baby obviously gets something like postpartum depression, which is a very common difficulty. Postpartum psychosis is a lot more rarer, but again, it's good to keep an eye on new mums. And psychosis can also be part of delusional disorder. Now, some people do experience psychosis on its own. If you've had psychosis for less than a month, so maybe you've had a brief psychotic experience and then, you know, things settle and your mental health is okay afterwards, then it might be referred to as a brief psychotic disorder. And you may also hear the term first episode of psychosis. And this is a term often used when someone presents to mental health services, they've got lots of psychotic symptoms, and it's the first sort of time that someone has struggled with these things. Until we've sort of got a longer term picture, we don't know if it could be part of a different mental health diagnosis or whether it is just a brief psychotic episode. So first episode of psychosis, it just literally means the first time you've had a psychotic episode. So what actually is psychosis then? Let's talk about what psychosis means and what the symptoms are. So one symptom in psychosis is this category here. So having disorganized thinking and speech. This is sometimes also called formal thought disorder. So you'll hear lots of different terms from mental health professionals. But basically, when someone is struggling with psychosis, it might do things to their thinking, and their brain might not function the same way it used to. So it might be that they get racing thoughts, where their thoughts are literally going so fast in their head, and they're having literally masses of thoughts all at once. And that can mean that their thoughts are racing so fast that the person feels out of control. It might be that they're talking 100 miles an hour because that's how fast their mind is working. A flight of ideas is where you might have one idea and then suddenly a different idea, and the person talking to you may change topic a lot, or may make sort of unusual links between something. So, for example, I might be talking about my guitar and then thinking about violins and how violin bows are made up of horsehair, and then I might start talking about my horse, and then I might think about my auntie in Spain who has a horse, and my topic will just sort of switch topic constantly. And somebody listening to me might wonder why I've gone from talking about my guitar to a violin to a horse to my auntie, because that doesn't make sense. Lots of people with psychosis might notice sort of racing thoughts and flights of ideas at the same time. Often, if your thoughts are going very quickly, again, you're going to have lots of different ideas. You're going to be talking very quickly. If your thinking is disorganized, that means that, you know, it's not thinking in the organized manner that most people are accustomed to. So somebody might be speaking very quickly, they might stumble over their words, so that it's really hard for other people to understand them. So, for example, you might be talking all over this and like just talking really quickly. Some people link words together because of the way how they sound, rather than sort of what they mean. And this can sometimes be called word salad. So instead of me having a sort of structured sentence, I like cats and dogs, it might be that I have a sentence, dogs and hogs and frogs and nogs and drogs, and using words because they're sort of rhyming or sounding quite similar. People with psychosis might change the topic very quickly because their thoughts are moving from one thing to another. So they might suddenly talk about their holiday in Barbados one moment, and the next moment talk about, I don't know, worms in the ground or a maths exam they had years ago. And it's sometimes hard to sort of follow somebody who's talking like that, but it's because that's what their thoughts are doing. They're just jumping from one topic to another. Because their sort of thoughts are going 100 miles an hour and they're all over the place, it might be that they find it difficult to keep their attention on one thing too. So they might really sort of struggle to stay concentrated. And a patient has said, you know, racing thoughts flooded my mind. It seemed as though my mind was disintegrating, my inner life. My unconscious mind started flooding my conscious without a break. That's someone sort of explaining what it was like for them experiencing disorganized thinking and speech. So our thoughts can be sort of all over the place, and that also affects our speech. It can also affect what we're doing. So instead of making a cup of tea, and we'll do that in a logical order, you know, boiling the water, putting in the tea bag, putting in the milk, it might be that someone puts in the milk, puts in the tea bag, and then boils the water, and then takes out the milk and then puts the hot water in. And again, they're sort of not doing things in a logical order because their mind is all over the place, and it's affecting them being able to logically do a task step by step how they normally would. It's going to be very frustrating as well. Another category of symptoms for psychosis is delusions. And lots of people have beliefs that other people don't share. That's very common. In a society, we have different religions. Some people believe in UFOs, some people don't. Some people believe in ghosts, some people don't. But a delusion is usually a belief that nobody else shares, and that other experiences or perceptions show that it can't be true. And it's natural for delusions to feel completely real to someone when they're experiencing them. Other people are likely to disagree with sort of delusions. So, for example, it could be, you know, me saying this background is orange and someone else seeing it as, I don't know, bright blue. And again, in their eyes, what they're experiencing, it is bright blue. That's exactly what they're seeing. So it's also very hard to help someone having delusions to see sort of the reality the way that you're seeing it, because in their eyes and their experiences, it is bright blue. It's completely real what they're going through, because that's what their brain is telling them. And I guess one piece of advice there, no matter how many times you say to someone, this is orange, if they're seeing it blue, they're going to believe it's blue. I meet lots of family members and even some professionals that will tell someone who is psychotic that they are wrong and the things that they believe are not true. But the problem is that's not going to change somebody's mind, because that's what they're seeing, that's what they're experiencing. And actually, what I tend to find is that listening to someone and empathizing with their experiences can be really helpful for them. And just remember, empathizing with how distressing it must be for somebody doesn't mean you're agreeing with them. You're not telling them, yes, that is correct, but you're understanding how hard it must be for them to experience that. So I've got some examples of delusions for you. And again, these are just common examples, but people can have delusions about all sorts of things. So common ones we hear might be people worrying that they're being followed by secret agents, the MI5, the police, or maybe being followed or stalked by members of the public. People might start to feel paranoid and worry that people are out to get them or are trying to kill them. Again, that could be strangers or societies or people that they know. It's common that people might worry about something being planted in their brain to monitor their thoughts, having maybe their electronics hacked, or being sort of monitored by certain devices. Sometimes people can have delusions about having special powers, or that they're on a special mission. Some people might believe that they're on a mission that God told them, or some people believe that they are God or that they have certain powers. Being poisoned is again a common concern, a common delusion people might have, whether that's their food, their water system, faulty products. Another common delusion is that maybe that person thinks they've done something bad or they've done something immoral. A delusion that we're hearing a lot in the pandemic is there are lots of people that worry that they are the ones that caused the pandemic, or they're the ones that are COVID and made COVID happen. People can often get extreme worries and preoccupations, and this can be about a number of topics. We all worry about lots of different things in life. And some people just get a sense of impending doom, like something awful is going to happen. Concerns that your loved ones are unsafe or that you are unsafe, again, is a common delusion. Thinking that other people can read your mind, or maybe that they can hear your thoughts, or maybe that your thoughts are being sent out somehow. Thinking that someone is putting ideas in your head and giving you thoughts that aren't yours. Getting special messages, maybe from the TV, social media, or the radio, or sort of getting told things in code. Again, they're quite common delusions. So as you can see, a delusion is basically a strong belief that someone can hold when they're psychotic. And it might not always match up with reality, but to that person at that time, it's very real. It's very believable. Another category we have, which is a common sort of group of symptoms for psychosis, is hallucinations. And when you hear the word hallucination, lots of people think it's, seeing things, but actually hallucinations can come in all five senses. And hallucinations are when someone thinks that they're experiencing something which nobody else can see. So, for example, it might be someone is hearing something or hearing voices that nobody else can hear, seeing things that other people can't see, feeling someone touching them, or feeling strange sensations which aren't sort of happening, or smelling things that other people can't smell, or tasting things as well. So, for example, seeing things that other people don't see. So it could be seeing people's faces, seeing animals, seeing religious figures. People might be seeing, I don't know, sort of very strange things. So bright colours or things that sort of stand out to them. Maybe something in the room just looks bigger or brighter or bolder than before. Maybe they're seeing things move that shouldn't be moving, or seeing weird things like a 10-foot spider climbing up the wall. People can see all kinds of things. Objects that seem distorted or move in ways they usually wouldn't. So maybe instead of seeing a river flowing how it normally does, they're seeing a river look really jagged and spiky. Experiencing taste, smells, and sensations that have no apparent cause. So, for example, a common thing I hear is people saying that they can feel sort of insects crawling on their skin, that sort of horrible creeping sensation. People might smell nasty smells that nobody else can smell. They might hear voices talking to them, but people can hear all sorts of things. It's not just voices. So some people might tell me that they can hear clicking, or they can hear animal sounds or whispering. Some people tell me they hear babies crying, or weird sort of muffled murmuring sounds or music. It can be anything that you hear. It doesn't just have to be voices. But hearing voices is a common thing. Some people hear their own thoughts, but sort of louder in their own heads. Some people know that it's their own thoughts. Some people might hear other people's voices in their own heads. Some people might hear something and it's just as real as how I'm talking now. So it literally sounds like someone is in the room with them talking to them, but they can't see anyone around. And how scary must that be to hear a really crystal clear voice, clear as day, but not being able to see anyone? That must be terrifying. And these experiences are really confusing for people. What is psychosis? Another group of symptoms that often I think people hear less about are negative symptoms. So the symptoms we've just talked about, delusions, hallucinations, disordered thinking and thoughts, those are what we call positive symptoms of psychosis. They're symptoms that are added when someone is unwell. Negative symptoms are when healthy things are taken away. So, for example, people might feel like their emotions are taken away and they might feel really flat or empty. They might look very sort of plain on their face and not very expressive anymore, which often is called being flat. Everything feels dampened down and flattened. It's very common that people might not talk very much, so to have what's called poverty of speech, where they may not have any words to say. They may be mute at times, or they may say very little, just sort of yes and no, quick answers. Some people might struggle to think. They might tell me that their head just feels empty. They've got no answers in their head, no thoughts, and they struggle to come up with ideas or to know what to say. People might struggle to initiate tasks. So they might struggle to get going and doing things. And it's very common that people might struggle with their motivation or their drive. So just feeling really lethargic, really tired, really unmotivated. People may feel really slow in their body, or they may feel like their body isn't working how it used to. It just feels really sort of rigid, like your limbs and body isn't working and moving how it used to move. A lack of appetite is quite common. So is a loss of sleep, actually. People can really struggle with sleep when they're psychotic. And again, insomnia is quite a common negative symptom. Poor concentration is a common symptom, and so is tiredness, that lack of energy and fatigue. So these are common negative symptoms that somebody might have with psychosis. Now, we've gone through the symptoms, but what I often get asked is, well, why do people get these symptoms? And, what can cause psychosis? And the truth is, we don't 100% know. But one theory is the dopamine hypothesis. So this is dopamine here. Dopamine is a neurotransmitter. So that is a chemical in the brain that helps to send messages and information around the brain. And one theory is that the chemicals in the brain, their balance has been affected, okay? And people who are under a lot of stress or are feeling really distressed or anxious, they might have heightened levels of dopamine. And what dopamine does, if we've got too much of it in our brain, is it heightens all our experiences. So this is where, instead of tasting, like just a lemon squash, it might feel really bright and vibrant and like the sharpest, the most sour thing you've ever tasted. Instead of just looking around the room that you're in, you might notice objects jumping out at you and think colours feeling brighter, textures feeling more intense. Your vision is much more intense. So let's go into this in more detail. So we can think in different ways as human beings. So if I said to you, imagine a mouse, if you try and imagine a mouse, you can probably picture a mouse in your mind and just imagine what a mouse looks like in your head. So some people can think in images. And again, if someone has a high level of dopamine in their brain, it might mean that instead of just thinking about a mouse, they actually see a real live mouse in their house, or they might see hundreds of mice running around the floor, which would be a visual hallucination. So again, dopamine can make common ways of thinking, seeing things in our heads, come out of our heads and feel a lot more vivid. Now, we all think in different ways. How I think is I can almost sort of hear my thoughts in my head. So I might be, I don't know, doing my work and I'll be thinking to myself, right, Molly, I need to send this email now. Let's write this. Dear so-and-so. I'll literally sort of talk to myself in my head like a sort of constant narrative. And we can think in words, and some people hear their words and their thoughts in their heads. So using the same example, you might hear the word mouse or see the word mouse if you think about a mouse. But again, with extra dopamine in our brain and the heightened experience, we might hear our thoughts differently. So our thoughts might feel louder, almost like we're shouting to ourselves in our heads. Or our thoughts might start to go outside of our head and we can literally start to hear things and hear our thoughts. So we might hear a ton of mice squeaking in our home, for example. So again, it can affect our sort of how we hear things and how we perceive sound. And that also goes to things like smells, like we talked about. You might start smelling mice inside your head and really smelling that sort of, maybe the droppings, maybe sort of that animal smell. Actually having that experience. Taste again, you might start to taste things in your mouth, noticing different flavours, different sensations. And touch we've already covered, so you might sort of feel mice crawling on your skin or brushing past your feet, and it's as if it was real. Okay, so it's not just, oh, I'm seeing a mouse, I know I'm seeing something. You're literally seeing a mouse as clear and crystal as day. You are literally hearing a voice like you're hearing me talk. It sounds as real. You're literally smelling something just as you would a waft of perfume. These experiences are really vivid and they're really real. And this is why they become so confusing for people that have psychosis, because these experiences feel so real, because that's what the brain is telling them. The brain is telling them this is happening. And naturally, we believe our brains. So it gets really confusing for people what's real and what's not when their brain is telling them a lot of confusing stuff. So we've talked about the symptoms of psychosis. Let's talk more about now what causes psychosis. And I think the best way to explain what causes psychosis is what we call a biopsychosocial model. So this means that our biology, lots of things that affect our biology, psychological factors, and social and environmental factors all combine to create psychosis. Okay, it's not psychosis usually isn't caused by one thing. It can be a combination of lots of different things. I'm going to go through some common causes for you now. So one common cause is our genetics. if you have family members that have mental health problems or who have struggled with psychosis themselves, it might be that you are genetically vulnerable to getting psychosis. And what we know is that nearly a third of people do have a relative with either a psychiatric condition or has experienced psychosis themselves. However, that does also mean that nearly 2/3 of patients haven't got a relative with sort of a family history of psychosis. So genes and DNA doesn't cause psychosis in itself. There's other things that can cause psychosis. It's not just in our DNA. That's only one influence. Drugs and alcohol is a common thing that does affect our brain chemistry. So again, it can have a big impact on psychosis. And you can get something called drug-induced psychosis, where if somebody has been taking drugs, whether that's once or whether that's several times, it can trigger a psychotic episode because drugs do affect our brain chemistry and can affect dopamine again. One thing that we know is that viral infections can also put someone at risk of a psychotic experience. Now, think about it. I've had viral infections in the past, and sometimes when we get fevers, if you have a really bad fever, it can be quite weird, can't it? You can maybe see things or have strange dreams. And for some people, if we have an extreme viral infection, it can give us psychotic experiences. Now, a common thing that can give people psychotic experiences, believe it or not, are UTIs or urine tract infections. So UTIs are very common, aren't they? Lots of people have had urine tract infections. But actually, if people get a really severe one, it has been known to give those people psychotic experiences. When I worked in the mental health hospital a few years ago, we would give people urine sort of tests and test their urine. And one reason we might test someone's urine is to see if they've got drugs in their system. But another reason is to check that they haven't got any urine tract infections, and to see if that's a possible cause for their psychotic symptoms. Again, as we know, coronavirus is a viral infection that's quite common at the moment. And actually, there is some research that people who have suffered coronavirus and been infected with coronavirus have then went on to have psychotic symptoms. And we've had an increase in people having a psychotic experience after having COVID. And again, that's because it's a viral infection. It can affect our brain chemistry and our physical health. Another thing that can affect our biology, leading to psychosis, our brain chemistry we've already talked about in terms of dopamine. But again, it's some things that can influence maybe the structure in our brain can also affect then the sort of amount of dopamine that we might have in our system. So as you can see, there's lots of different biological factors that can influence psychosis, and these are just the common ones. There are other things too, like people who have been malnourished or have got vitamin deficiencies, or maybe they've had ammonia build up in their brain. There can be lots of other factors that can play a part in developing psychosis. Social factors. Stress can be a trigger for psychosis when we have extreme stress. And again, if you're working in a stressful environment, or I don't know, living in a stressful environment, it can have an impact on psychosis. People who maybe have difficulties in their support network, maybe there's lots of arguments going on, or they're feeling very isolated, that can play an impact. And also our resources. So, if we're struggling economically, financially, if we're living in a sort of difficult neighbourhood or area, these can play an impact. So now we'll have a look at psychological factors. And what we know is that people with psychosis, there is a link between trauma and psychosis. People that have had PTSD or traumatic experiences, again, like it can lead for some people into psychosis. People who struggle to cope with stress, again, it can lead to a vulnerability for psychosis. We know that childhood experiences and difficult childhoods can affect a person's belief system, and that sort of vulnerability in someone's belief system and thinking, again, may make them a bit vulnerable to a psychotic episode. And also our thinking style. So what I see a lot of is I see a lot of patients where maybe they've had a history of being a worrier or thinking very negatively, having a poor self-esteem, being very self-critical. That in itself doesn't cause psychosis, but again, it can put someone at a vulnerability to having psychosis. And like we said, you may notice some of these things in yourself. I'm a worrier. You know, we all will have some of these things. We all have stress in our social life at times in a stressful environment. However, it's the unlucky combination of things that can lead someone to having psychosis. It's the overlap of these things and the stress levels and the overlap being so high and significant that it triggers a psychotic episode. Not everyone who's stressed or worried gets psychosis. So what do we know about recovery and the long-term sort of outcomes of psychosis? Well, the best information I can give you is the literature by this person here. I'm not good at pronunciation, but I'm guessing it's Compi possibly. This person traced 289 people, and they traced them who had had sort of psychotic episodes in their life during that century. And what he tracked was when their psychosis happened, what happened with their psychosis, were there any long-term effects, and how was their recovery. And what he found was about half the patients had an acute episode, which means, you know, it's quite a short episode, basically. The other half showed a slower onset, so the psychosis came on a lot slower. There's something called a prodromal phase, which is where someone might be quite anxious, quite depressed, quite fatigued, and it starts off as sort of quite mild symptoms and gradually gets worse until it hits full-blown psychosis. So as you can see, there's different groups here. Some people get psychosis very quickly and it can, again, settle quite quickly. Some people get psychosis slowly and gradually. But what he found is that around half of the people in the study, around half of the people in the study had an episode of psychosis, and the other half may have had continuous symptoms of psychosis. In terms of the outcome, for half the cases, people had mild impairment, and for the other part of that, some people had full recovery in the other half. In the other group, people had full recovery in a quarter of the cases. So in terms of outcome there, half of the cases had mild impairment or full recovery, and a quarter of the patients had full recovery. If we look at schizophrenia outcomes, which is a more chronic, enduring mental health condition, the outcomes are a bit more difficulty and it can be less favourable. However, there are still different groups of impairment here. So group 1, someone with schizophrenia may have one psychotic episode only and no impairment, and that's 16% of people that may have one episode and then they're perfectly fine afterwards. The second group, people may have a few episodes of psychotic experiences, but either no impairment, no sort of issues in the long term, or very mild, minimal effects. And that's 32% of people that may be in that group. The third group, people can have a first episode of psychosis and they might notice sort of longer term difficulties. And then they may have sort of some symptoms that don't sort of go, but they don't get worse after each episode. And the last group, people may have impairment, and unfortunately, after each sort of extra episode, they may notice more impairment. what we know about recovery there is that there are 4 different types of recovery. Okay, so we've got what's called a clinical recovery, which is where we're getting rid of those positive symptoms, so the person doesn't have any hallucinations, doesn't have any delusions anymore. We've got something called complete recovery, which is where people go back to their levels of functioning how they were before. They go back to, being able to speak, to think, to do things exactly how they functioned before they were ill. We have a social recovery. So this is where someone may have some symptoms still remaining. However, they're able to go back to their social lives. They're able to go back to work. They're able to be independent and, engage in life again. And a psychological recovery. So it might be that somebody does still have some symptoms. Maybe they do still have voices. However, they're able to cope with those things. They're able to adjust to their life so it doesn't cause them distress. And it's important to mention that around half of the individuals who are given a diagnosis of psychosis recover with no or mild impairment. Okay, so over half of the people who have a psychotic episode don't have long-term effects from it. What affects better recovery outcome? Well, people who have high levels of functioning, so they've got a good social life, they've got a job, that if you have that before you become unwell, that's a factor that shows that your recovery may be quite good in the longer term. People that had a sudden onset of positive symptoms, so someone who was perfectly fine and then got psychotic very quick, and then gets well again very quickly, they tend to have better recovery. People who have an onset later in life, so it is common that we might get someone like, I don't know, a 40-year-old man or a 55-year-old woman having their first psychotic episode, and that's actually a good sign because they've not had it earlier in their life. They're actually having it quite later on in life, which generally those people have a better chance of recovery and getting back to their normal function. If people are in a low stress environment, and they've got time to rest, to relax, they've got a good work-life balance, they don't have a stressful home environment, that's a good factor for recovery. Now, another key factor that can help recovery is taking your antipsychotic medication. It is important. It's an important factor for recovery. There are lots of patients that do suddenly stop taking their medication and they might notice then that they become unwell again. Now, sticking to your antipsychotics, following the doses that your psychiatrist prescribes. If you are going to come off the medication, again, doing it supported by your psychiatrist and slowly lowering dosages is going to help your recovery. Now, we've already said alcohol and drugs can trigger psychotic episodes, and it is important that people abstain from alcohol and especially drugs if they've had difficulties with psychosis. If you're taking substances that affect your brain chemistry, then it is going to make you vulnerable to having another psychotic episode. So if you have had psychotic experiences, it is important that you do take care of your lifestyle. And that also does include, healthy diets, healthy eating, getting enough sleep, exercise. These are all things that are going to help your general health and well-being and also help your recovery and risk of further episodes. Structured daily activities, again, having a good routine, having hobbies in your life, a purpose, meaning, a social life, possibly work or volunteering, or just, some meaning in life. That's really important for recovery. And of course, we need our basic needs met. We need housing. We need somewhere where we can live that's safe and stable. And we need to have finances so that we can live. And without that, it can cause us a lot of stress. So that is equally a factor that helps our recovery. And learning how to manage stress and improve our coping skills, improving our resilience can really help our recovery. And this is why psychological therapies can be really important in terms of helping recovery from psychosis. So what help is there? What happens with treatment? Well, like we said, one thing that is key for helping recovery is staying on antipsychotic medication if you have that prescribed for you. And what we often do in the NHS, if someone comes to us and has a psychotic episode, we tend to treat it really aggressively with medication. We'll give people quite high doses of medication, and it is quite strong stuff, the antipsychotics the psychiatrists will prescribe. But the reason we do that is because if we treat a first episode really strongly from the start, it can lower the risks of that person having another psychotic episode or long-term effects or impairment from the psychosis. So that's why if someone comes to mental health services and they're having psychotic experiences, we will treat it hard and fast because it will help someone in the long run if we can nip it in the bud early. It is important to know that treatment methods have improved and antipsychotics have improved as well. There are different generations of antipsychotics, and there's a lot of choice now in antipsychotics, so that the psychiatrist can look at what's going to suit you and helping you to manage side effects where possible. Again, people can also get things called a depot, which might be a sort of antipsychotic injection that you have, so you don't have to take pills on a daily basis. People are offered more choice for their treatment these days, and there is more flexibility in services to meet your needs. Also, it's important to know not everyone has to go to hospital. Being psychosis doesn't necessarily mean you're going to get locked up or sectioned. Often mental health services have specialised psychosis teams in the community services who can treat you at your home or see you in sort of outpatient clinics. And our goal ultimately is to avoid you going into hospital. We don't want people going into hospital if we can help it. It's nice to avoid that. Taking medications is often a key part of treatment. Alongside lifestyle changes that we've already talked about, so diet, sleep, not taking alcohol and drugs, learning to manage stress. There are other types of treatment and interventions on offer. One of them is occupational therapy, which is helping you to engage in the activities and things in your life that are meaningful to you. Talking therapies, so this might include family therapies that is recommended for people who have psychosis. Family therapies is sort of NICE guideline recommended. It could also be couples therapies if it's more sort of two of you. Psychological education to understand psychosis is recommended, and so is CBT for psychosis. There's lots of different psychological interventions that can help people with psychosis. There's a lot out there. Just to finish, I'd like to share with you some resources and things that I find really helpful and that I like to direct patients to. So there is a TED Talk, which I think is very hopeful. It's a very reassuring TED Talk, and it's by this lady here, Eleanor Longden. And she is a lady who experienced voices when she was at university, and she talks about her journey with psychosis, and it's a hopeful journey. She explains how she learned to cope and manage her psychosis and live a positive and good quality of life. So I do recommend that TED Talk. It's well worth the watch. There is a BBC programme you might have seen, Why Do People Hear Voices in Their Heads, which again looks at sort of understanding and explaining psychosis. And there's some really good websites out there. I hear a lot of people telling me, I thought I was the only one having this experience. The Understanding Voices website is really helpful. It was made by Durham University. It helps people find information about lots of different sort of experiences hearing voices. There's support, there's information and advice about coping with voices. It's a really good read. Northumberland, Tyne and Ware, their NHS trust, have a really helpful self-help website. It's got lots of different self-help guides on things like sleep, PTSD, worry, depression, stress, you name it. But they do also have a leaflet on hearing voices and disturbing beliefs or delusions, which is well worth a look. Again, there's some really good self-help guides there. The Hearing Voices Network is a really useful network to get in touch with. And again, you've got their website here. It gives people information about psychosis. There's lots of support and understanding, and it's nice to know that you're not alone. There's lots of experiences that you can read from sort of other people's journeys. And it also includes people who might see things or who might feel things, as well as hearing voices. Paranoia can be a common symptom of psychosis. Again, it can be part of that sort of delusional system we talked about. And there's also a national paranoia network, which is well worth a look again, just to sort of understand those experiences and for information and support. And lastly, the National Perceptions Forum. So for people that maybe hear voices or have beliefs or perceptions that other people don't share, again, it's good to know that you're not alone and to have a place for support. So I do recommend these places. Please do check them out. I think they are very useful. And I've worked with lots of patients in the NHS who have found these resources really helpful. I hope that has given you some factual explanations and understandings about psychosis. What I tend to find is that people want the facts. They want to understand what are the symptoms, what are the causes, what's the treatment like, what can I expect in the longer term. And feedback from sort of family members and loved ones is often having this sort of explanation helps. So I hope it helped you today, sort of sharing this information. I would like to refer you back to, again, where you get more help. Please do speak to your GP if you feel you're struggling with psychosis or a loved one is. If it is an emergency, please do call 999 or go to A&E. And if it is out of hours, if you can't speak to your GP in the day, or maybe it's a bank holiday, for example, or a weekend, you can find your local mental health helpline here. And that will put you through to a mental health professional. And again, they can take a referral or you can raise concerns with them and you'd get advice and support from that professional. If you think you are struggling with any mental health difficulty, whether it's psychosis or something else, please do get yourself support. There's a lot of things out there that can help you. I hope this has been helpful. Thank you very much for staying with me and for listening. And again, please have a look at CBT and me. There's lots of different videos on lots of different topics. Try to spread some psychological information. Thank you. Bye.